Ready. In this video, we viewed an individual at the store, grabbing an item from the shelf and placing it into their shopping cart. To mimic this, we used a cabinet from the lab to act as a shelf and the rolling table as a shopping cart. We first see the individual standing facing the shelf. Based on the task they are performing, we see them initiate the movement by weight shifting onto their left lower extremity, flexing their right shoulder and elbow, pronating their right forearm, and slightly extending their wrists and digits to prepare to grasp the item. The individual then grasps the object through flexing their wrists and fingers. Once grasped, the individual removes the object out of the shelf. To do this, they weight shift to their right lower extremity, extend their shoulder, extend their elbow, and release the object onto the cart. Along with these movements, we can see the individual's eyes follow the rotational moment, causing their head to rotate as well as their trunk to slightly rotate towards the cart. The individual then repeats the same movements. In discussing judgment, we know the primary motor cortex, or Brodmann area 4, is needed for selective motor control. Based off of the size of the object that this individual is grabbing out of the shelf and placing into their cart, the primary motor cortex was very necessary to regulate the amount of motor units necessary to complete this task. For emotional tone, the limbic lobe and the amygdala are needed to regulate emotional control. Here we see that there's no significant increase or decrease in emotions as the individual performs this task. In terms of memory, based on the movement, it appears the individual has gone shopping before and gets this item regularly. The medial temporal lobe / cortex, the prefrontal cortex, and the hippocampus are involved with memory. For motivation, the amygdala and medial prefrontal cortex are involved. The motivation for this individual was to grab the object from the shelf and place it in their cart because I'm sure they wanted to eat it later on in the day. That would be my motivation.
The anticipation of this motion is done from the premotor cortex, which is Brodmann's area 6 and is in charge of anticipatory postural changes of the trunk. Planning of the movement is done by the cerebellum as well as the lateral prefrontal cortex, with the lateral prefrontal cortex in charge of planning and problem solving. So in our example, the problem solving was how to reach for the item and how to grasp it to place back in the cart. Programming of the action was done by the premotor cortex and the supplementary motor cortex, which the supplementary motor cortex is Brodmann's area 6 medially. Execution of this action is performed from the lateral prefrontal cortex, which is goal-directed behavior. So in our example, the goal was to grab the item off of the shelf and then place it in the cart. The skills of this motion are performed from the primary motor cortex, which is going to be in charge of selective motor control, as well as the supplementary motor cortex, which is involved in planning these complex movements. The function of our action is performed by the primary motor cortex, which again is Brodmann's area 4 and is in charge of selective motor control. So for our example, this was grabbing the item and placing it back in the cart. The cerebellum controls this following movement with smooth and orderly sequencing, and with this it uses multiple parts of the cerebellum. The first part is the vestibulocerebellum. So during the motion, the individual's head and eyes are locking towards the direction that they are turning, and we can also see the axial skeleton and proximal muscles working to facilitate rotation and initiation for reaching the objects. The spinocerebellum is used for efficiency of the ongoing motion of reaching, turning, grasping, and placing the object into the cart. We also see usage of axial and proximal limb muscles during the rotation and reaching, as well as control of distal muscles to grasp and lightly place the object in the cart. The cerebrocerebellum during the program is in charge of programming, timing, and initiation of the movement throughout the movement, as well as usage of distal limb muscles in the upper and lower extremities. So in our example, these distal limb muscles are in the wrist and hand to grab the item, as well as place it in the cart. The cerebellum controls direction of our movement in a multitude of ways. The vestibulocerebellum is responsible for the head and eye movements, so during our action, The vestibulocerebellum works to maintain head and eye movements when reaching for the item, as well as placing the item in the cart, which in our video, the cart was the desk. The vestibulocerebellum also assists with normal stance and staying stationary throughout the movement. The spinocerebellum worked in our example to control axial and proximal muscles when reaching for the item, and this input is from the interposed nuclei. The cerebrocerebellum worked in our example to control distal muscles of the hand when reaching for the item and putting it in the cart, and again, these were the distal muscles of the wrist and hand.
The cerebellum also regulates the extent of the control of the motion. This includes range and amplitude. During shoulder flexion and the observed motion for reaching for an item on the shelf, the individual provided appropriate amplitude of shoulder flexion along with the grasping motion. The motion was not overshot, resulting in the individual passing the shelf and having to come back to the height of the shelf. Additionally, the individual did not undershoot the amplitude, resulting in not being able to reach into the height of the shelf. With grasp, the patient also provides proper amplitude of motion, resulting in the item not being crushed, which would be an overshoot, and also the item not falling out of his hand, which would result in undershooting. The cerebellum is involved in this amplitude generation and modulation via the spinocerebellar tract and the interposed nuclei of the cerebellum. Force generation is also influenced by the cerebellum. In our example, the movement observed was grabbing an item off a high shelf. The cerebellum worked during this movement to facilitate grip control by anticipating the amount of voluntary control of muscles required to lift the object from the high shelf and place it into the cart, and then to release the item by relaxing the voluntary muscles. There is input during this motion from the cerebrocerebellum by programming and timing the movement via the dentate nucleus and the red nucleus contralaterally. Timing was managed during this action by input from the dentate nucleus and the red nucleus. These nuclei give input to the cerebrocerebellum about timing of actions. The cerebrocerebellum allowed the individual to time the action of grabbing the item at the high point and then moving it to the cart where it is timed to release the item. The programming of this movement was also receiving input from the cerebrocerebellum to perform the action multiple times. Muscle tone of this action was modulated by the spinocerebellum and more specifically the vermis region. The vermis region receives information from the spinal cord to regulate postural control during the movement. Appropriate muscle tone was achieved during the motion by allowing the patient to stand up straight and keep their head and eye positioned throughout the entire movement. Cerebellar output reaches the final motor pathway for performance through the closed loop of feedback. In our example, the patient is reaching for an item and placing it in the cart. The closed loop feedback gives the patient information on the efficiency of the movement. Additionally, it gives the patient feedback about if they have reached enough for the item, if they have used enough force to grab the item, and if they relax the muscles enough to softly drop the item in the cart.